Hi, I am Dr. Cassidy, and this is Dr. Jess. We are going to teach you guys how to improve your sinus and ear drainage at home with some of these manual techniques. So we're going to go through how you drain everything from the head and neck, so a lot of lymph drainage support, and then we will go into some sinus drainage, and then we'll finish finally with that ear drainage. So if you're feeling that blocked ear sensation, that's the piece that you're going to want to wait to see.
Or like a lot of fluid in the ears, or like very like full feeling.
Yes, the fullness. Yeah. That auditory tube, it's a tube that connects from your inner ear to the back of your throat. It has a few jobs. It helps regulate ear pressure. That's why your ears tend to pop if you are driving in the mountains or on airplanes. Sometimes yawning, you'll know, will pop your ears back, and that is because jaw movement also drains your auditory tube. So yawning, trying to yawn, opening that mouth really wide is also something you can try at home to aid in that drainage. I'm just using peppermint lotion on Jess's neck and by her clavicles, her collarbones, that is. And I did get it all over your shirt. That's lovely.
Totally fine.
So that collarbone, I'm going to be massaging in circles above and below the collarbone. And when I feel a little spot that I think is tender, which is probably right here on Dr. Jess, I'm just gonna hang out and do some light circles. I can work all the way out to that shoulder, and then I do wanna make sure I do on top of that collarbone as well. We have a lot of lymph nodes, and the lymph duct lives right underneath our collarbone here. So that's where I like to start, because if it can't drain past that, it's not going to drain any further. Now I'm moving to the neck. I'm going to massage from the back of her ear down the front. And you can go light, you can go hard, whatever feels really good. Similar to that spot around your collarbone, this is where all your cervical lymph nodes are gonna live. So if you are congested, you might feel an enlarged lymph node. It's usually nothing. Good, and I will do the other side just for good measure. So above and below that collarbone again, hang out whenever you hit a tender spot. Sorry about that, my fingers slipped a little bit. And above. Down from the back of the ear. If you don't have a partner, you can totally do this on yourself. I will say the drainage that happens in the mouth is a little bit tricky to do on your own. The next portion is going to involve me percussing and massaging along Dr. Jess's frontal and maxillary sinuses. It feels really good when you're congested, even if it is a little tender, but just be mindful, especially maybe if you're doing this on a kiddo or one of, a little one, someone else, just be mindful of your pressure, because like I said, if it's that full feeling, if you're infected, it might be tender. So frontal sinuses, you're gonna find the eyebrow and go just outward towards the ear, not to the middle of the eye, but that's where you'll find a little dip. That is your frontal sinus, and I am just going to start with circles. You can also percuss, just lightly tapping. We also say this is like a patonement. And just tap, tap, tap. Beautiful. And then for the nasal sinuses, or the maxillary sinuses, I'm going to do the same thing. Out from the ear, this is a little bit below your cheekbones, wherever you're putting your blush. It's kind of in that area, and oftentimes you can feel the dip in that sinus as well. And I'm giving some good pressure with tapping. Actually, tapping tends to be a little less provoking than the rubbing. Dr. Jess might be able to.
Yeah, agreed.
Agree with that. Yeah. And finally, we are gonna go inside the mouth to help support that drainage of all that fluid and that congestion downward. I'm gonna use a glove on Dr. Jess. If you're doing this on yourself or a kid or one of your kiddos, just make sure your hands are clean. How I'm gonna go about this is I'm gonna follow her teeth line. That's gonna do a few things. One, it's gonna give me landmarks so I know where I'm at. Two, it's gonna help her not be so gaggy, because I'm gonna go pretty back in the throat. If I follow the teeth, it probably won't provoke that gag reflex quite as bad. So I'm following the teeth back until that hard palate gets squishy, and then I'm gonna do 3 rainbows outward. So right behind your teeth, your palate is really hard. If you go far enough back, that palate gets soft. That's where I'm doing my rainbows to help support the sinus component. I'm gonna do that one more time. Follow those teeth back, soft rainbows. Beautiful. And now for the ear drainage, that's even further back. It's right behind the back of the molars. So it's not uncommon for people to get a little coffee or something like that, especially if they're congested, because the drainage flow can be pretty immediate. So follow those teeth back. Instead of going to the soft palate, I go behind that molar and sweep down the side of the mouth. I am gonna do
it's like, for reference, it's like right here, inside the mouth. So
I am gonna do the other side just for another viewpoint. So again, sinuses, you follow that hard palate back till it gets squishy, rainbow out. Give whoever you are working on a break if it's not yourself, and then further back for the air, behind the molar, sweep down. Amazing. Dr. Jess was a great patient.
Love it.
Absolutely. If you have any questions, leave them in the comments and we would love to connect with you.